Insurance Fund is set to be renamed the National Health Insurance Fund. This change is seen as part of operationalisation of the right to health.
Essential medicine may also be more readily available in hospitals once the Kenya Medical Supplies Agency is transformed into an independent authority with its own budget line. KTN's Ansoi Mwendia with this report.
Cabinet passed the Kenya Medical Supplies Authority Bill of 2012 Thursday, in a move the industry has received well and hopes will improve procurement and distribution of medicine for public hospitals in the country. The Pharmaceutical Society of Kenya PSK says it is happy with the move to create an autonomous authority under an Act of Parliament as opposed to the current agency created through a legal notice and operating under the Ministry of Medical Services.
It gives it more powers without interference from the line ministry so that they can make the operations more efficient. Two, also it will have its own budget, whereby this money is actually is given to KEMSA for procurement. Right now it waits for the line ministry to tell them we have this money, now procure.
Dr. Paul Moniki, the chair of PSK, says the bill, once enacted, will empower KEMSA to set its priorities based on orders from counties.
Each county will be able to procure and even give the orders to KEMSA depending on their needs. Not what KEMSA thinks or what the ministry thinks they need. That is now the pull system, not the push what they have been doing now, which has not been efficient. With that system we are getting, first of all, some essential drugs lacking in some particular regions, and which are actually needed elsewhere.
The authority shall procure, warehouse and distribute drugs and medical supplies for prescribed public health programs, the National Strategic Reserve, prescribed essential health packages and national referral hospitals. The authority shall also play an advisory role to the health facilities at both national and county governments. Dr. Moniki is, however, keen to have the number of pharmacists in the KEMSA board increased.
At least 2/3 of that board there must be pharmacists.
Other players in the sector lauded the move to trim the size of the board to 7. The National Hospital Insurance Fund, NHIF, is also set to transform into a health fund which will set the stage for universal health insurance. The move towards universal cover for all Kenyans has been bitterly contested since it was first introduced by Charity Ngilu, who was health minister in 2005. The guarantee of right to health under the new constitution, however, provides a framework for health insurance for all, including those without an income. This transformation of NHIF will allow both the employer and the employee to contribute to the fund. Cabinet also approved the National Ambulance Service that will ensure all Kenyans have access to ambulance services. Ansoi Mwendia, KTN Prime.